How you doing? Hi, Ms. Nelson. I'm Preston. I'm a student physical therapist here at UW-Milwaukee. I see that you're in here for an examination today. I read your chart. It sounds like you're 1 month out from total hip replacement. And I heard that you have some lower right leg pain. Is that correct?
Yes.
Awesome. So with your permission, we're going to just start by locating a few different structures and try to isolate some of that pain on your right leg.
Yes, that is okay.
Okay, so I'll just have you lay down here with, you can just lay on your back. And then I'm going to start looking at your left side over here, okay? Because this is your non-affected side, and I'm just going to try to get a baseline for what might be causing you some issues, okay? All right, so we're going to begin with a little bit of locating a few structures here. And I know you just had right hip surgery, so I know there's expected tightness and some pain associated with that.
Yep, just a little
But
bit.
a lot of your complaints are coming down from your lower leg, so we're going to start looking right here about at the knee, okay?
Okay.
All right, and so is there any sort of pain right here?
Just a little bit, yeah.
Okay.
Some tingling down the leg.
How about here?
No.
Oh, okay. And so you said some tingling down the leg.
Yeah.
Will I apply some pressure right here?
Yeah.
Okay. But what about as we move here into the lower leg?
No.
And same for this side?
Yep.
There's no pain?
No pain.
Okay. And are you able to feel
Yep.
this?
Yep.
No pain? Now what if I apply some pressure right here?
Yeah, I can't feel.
Okay.
I just get that tingling from your hand. Are you actually touching my leg down there?
Yeah, I'm
Oh,
actually
okay.
touching, so. All right, so we have already taken your range of motion here on the left side to kind of establish a baseline. We're gonna move to your right side now and try to really find out what exactly is limiting your range of motion. So I'm gonna start here measuring your plantar flexion. And I am going to line it up. I'm gonna start here. 90. All right. And then if I could have you point your toes down. All right. Looks like 34 degrees of plantar flexion. Good. So now we're going to move on to dorsiflexion. And this is just going to be having you point your toes up towards you, okay? So I'm going to set this up here. And I'm going to have you start at 90. Okay, and then if you could bring your toes up toward you. All right, and that's, you're doing it?
That's all I got.
All right, that's all you got. So right there we have 0 degrees of dorsiflexion. And next we're going to be doing some pronation. Okay. Okay. So I'm going to have you bring this foot out here toward me if you can, okay? So kind of tilt it this way. And are you able to do that?
That's all I got.
That's all you got. All right, so I actually have a recording of -3 degrees of pronation. So then supination is going to be much the same. It's going to be having you bring this side of your foot inward toward your other foot, okay? And can you do that? And I have a record of from 3 to 30 degrees.
Okay.
All right. All right. So now we are going to be just working at here on your big toe, okay? So we're going to measure the flexion and extension of your big toe. So I'm going to set up the goniometer right here. And we're going to bisect the first ray. And then so what I want you to do to begin is I want you to flex your toe down to the ground. All right. And I have a measurement of 20 degrees from 0 to 20. All right, you can come back up to normal. All right, and then I'll have you bring your toe toward the ceiling as high as you can. And here I have a measurement of 30 degrees of toe extension. All right. All right, Ms. Nelson. So we had just measured your active range of motion of your right side here, and so I want to see if there's a difference between what you're able to do yourself and what I'm able to get your joint to.
All right, that sounds good.
All right, so we're going to start here with plantar flexion, and you don't have to worry about anything. I'm just going to set the goniometer up right here, and I'm going to start you at 90. Okay. And now I'm going to plantar flex you. And we have a recording of 40 degrees. You can relax. So we have 40 degrees of plantar flexion. And so that is actually 6 degrees more than what you're able to get to yourself. And now we're going to measure dorsiflexion. And I'm going to bring you back to 90 here. All right. And then I'm going to dorsiflex you. And you look at that, you are able to get 30 degrees. And so
that's way better.
That's way more. So what you're able at just 0 yourself, and I was able to get you to 30 degrees.
That's a big difference.
Yes, it's quite a big difference. And then one of the other ones we're going to do here is your pronation. And so I'm going to be measuring the evert in here. Bisect the second ray. We're going to start at 0. Okay, and we're going to evert, and got 20 degrees. You can relax. And so for that one, you were actually just able to get -3 degrees yourself.
What does that mean?
So that means you weren't even able to start coming to the outside of your body there.
Okay.
So you're actually 3 degrees more toward your midline.
Well, that doesn't sound good.
No. So, and then we're going to perform a few other tests. All right. So our last test we're going to look at is your big toe again. And this time I am going to be bending your toe up toward the ceiling. And we're going to see the range of motion at your MTP joint. Okay. So we have it right here. And we're going to start at 0, and we are going to bend you up, and you have, relax, you have 80 degrees of toe extension, and like we had said before, you just had got to 30 previously, so that is quite a significant difference.
Wow.
All right, Ms. Nelson, so we are going to be looking at a few manual muscle tests which assess your strength in your lower leg.
Sounds good to me.
Okay, so the first one we're going to be doing is the soleus, which is back here in your calf region. And I am going to have you bend your knee up to 90, right about there, good. And then I'm just going to have you point your toes down, point your toes up in the sky and back down. There we go. Okay, so then I'm going to have you point again, and then I'm going to be pulling here, and I want you to resist this pressure, okay? Awesome. So that is a 5 out of 5 score for the soleus manual muscle test. And then I will have you flip back over onto your back. And then I will have you come off. Can you scooch down a little bit further so I can have your feet off the table? And there we go. Okay. So now we're going to be looking at your anterior tibialis and fibularis longus and brevis. So these are 2 muscles that are running on the front and the side of your shin. Okay. So the first one is the tibia anterior. So what I'm going to have you try to do is bring your foot up toward the ceiling. Okay. So, and then you can't really do that. So then I'm not going to ask you to try to invert it there. And then I'm going to ask you, can you push your foot down toward the floor, and then can you bring it out a little bit? Okay, so you're not really able to do that as well. All right, so I'm going to take this out from under you, and then I'll actually have you flip to your side. All right, Miss Nelson. So now that you're in a gravity eliminated position, we are going to be trying to see if you have any strength of the tibia anterior and the fibularis longus brevis, which is located here and here on your calf. Okay.
All right.
And so I'm going to support your leg here, and then I'm going to try to have you bring your foot up toward your body. Okay, and you're not able to do that. And then I'm going to try to have you do it again. And I'm going to. All right, I do feel a muscle contraction here in your tibia anterior muscle belly. So I would give that a 1 out of 5 score for the tibia anterior manual muscle test. And now we're going to be transitioning to a little bit more of the lateral side of your leg, which is over here. And I'm going to feel the muscle belly here. And so last time you were able to plantar flex, but that was due to the soleus and gastroc. And so we're going to see if you are able to plantar flex and go from there. And, all right. And you can point your toes down. All right. And I do feel muscle contraction there. And that is a 1 out of 5.